Welcome to the Transforming Healthcare Coaching Podcast, where we're all about helping healthcare professionals like you create positive change at work, at home, and everywhere in between.
Welcome, everybody, to a new episode for Transforming Healthcare Coaching. And today I get to interview our founder of Transforming Healthcare Coaching, Lilly. And today we're going to talk about servant leadership. And I'm curious to know and hear your take on servant leadership and what our audience can kind of get from what is servant leadership and how can they apply that to their own life. So let's start off right there and then. Lilly, what exactly is servant leadership? And do you think it exists in healthcare?
Yeah, so servant leadership in healthcare really centers on the idea the leaders exist to serve their teams, their patients, and their communities. And really, it's not meant to be a top-down kind of idea where if you have a servant leader or supervisor or boss, their goal is to make everything work better for you as the team or you as the patient. At a greater scale, servant organizations serve the communities. I think the hard thing is sometimes the word servant leadership really resonates for some people. And you can see it every day, the way they help others. And then for other people, it bristles them a little bit and they don't really identify with that term. I think that's the challenge sometimes we find in healthcare, that maybe half the audience does and half the audience doesn't.
I'm curious because as a frontline healthcare professional myself, we think of our supervisors, our managers, the C-suite, the administrators. I guess the term leadership we think is all-encompassing for all those roles. What make the word servant different in this regard?
Yeah, I think this for some people, the word servant is a little bit triggering. It has a connotation where there are hierarchies and there are ways where there is a better than potentially or a less than kind of classism. I think that unfortunately, it's for many people of Christian faith, this actually really does resonate because it is in service to other humans that we do go into healthcare and do things. And so my take, and again, I'm interested in what our viewers think when they send us emails and comments about this episode, is this model is supposed to really be about empathy and active listening and collaboration with others and committing our own personal professional growth, our own personal professional decisions for the good of others, teams, patients, the community at large. And so if we ground into that leadership model, rather than much more corporate philosophies of ROI or strategic thinking or innovation, other different transformations. So a leader who's really geared towards transformation may sacrifice some of these much more interpersonal empathic skills for the goal of making something completely different, either for culture or for technology or for scale. Even just these words, they mean different things to us. And I think for many people, the word servant leadership is actually the reason why many of us remember going back into healthcare so long ago when we were in high school. Like the journey to get into healthcare is a very long one. And it started back when we were, 15, 16.
Yeah. So it sounds like it's more than just nomenclature, calling yourself a servant leadership. It's actually embodying that role of true service, from service to your team, service to patients, service just into healthcare in general. And so how often do you think healthcare leaders are calling themselves servant leaders in the healthcare landscape?
I don't find it that often. And I'd be curious to hear from your perspective as well. I work for more than one organization, and I obviously don't speak on behalf of those organizations. I feel there are certain individuals in certain organizations where I do feel it quite a bit. I think the one particular leader I'm thinking of, he makes it very clear and actually states the sentence to remind everyone from C-suite down, like that's the real reason why we're doing this, even though it's a metric that we have to do, or it's a matter of getting more patients available into our system. He himself is a veteran, and as a veteran leader, he puts front and center the service back to the veteran community. And I think that's a little bit harder sometimes when you're in different for-profit or even private practice healthcare organizations. But it is also possible, even when you have your own practice and your own group and you're trying to scale for a region to give, for example, even some specialty care. for how you're serving the community. And I see it oftentimes with my direct primary care colleagues where they very much give back and they overtly give back and they actually welcome other ways and they can partner with the community to make it obvious that that is the reason why they stayed in the location they're staying and why they're opening certain branches in the region.
Yeah, no, this is great to hear. And I think a lot of people probably embody, especially in healthcare, a lot of leaders embody this kind of servant mindset, but may not be calling themselves that for the reasons you had mentioned earlier, that it may trigger some people and it may not be the best nomenclature because, as we know, nomenclature does come with bias. So I'm curious, what other leadership descriptions or models out there that you see?
Well, I think a common one that we often hear nowadays is transformational or innovative, where it's really about new vision and the future, especially with technology and AI. So I think many people would like to see the healthcare system completely different, like blow it up and start all over. So I know that there are certain colleagues who I've met who are all about that, which is changing the payer structure, changing the access. Because we have to admit, there's a lot of things about accessing healthcare in the United States that really aren't working. So there are people who are in that boat. Transactional is maybe another way you might be able to see things where some people just really feel that at the end of the day, it's a product or a service that you buy. And so you'll go and compare to a little bit. This is why they have those customer press ganey reviews. Just it's a Google Yelp for your clinician. And then people have actually commoditized that, whether the public has or whether the institution has, but more transactional, where the better service we give, the better five-star reviews you're gonna give me on Google. And so transactional is mostly focused on that kind of performance data. And I mean, as you can see, there's nothing wrong with that either because you do wanna go to a five-star organization. And yet at the same time, we all know that what you measure can falsely change how you operate. Other kind of models that people often see are democratic groups. We often see this in emergency medicine where you really want to have a group where everybody has a say in where we move forward. And so it's almost like a voting rights club where very large practices, especially the partners, decide where and what you do next in terms of moving the group forward. And so smaller, more private groups, maybe a little bit more democratic. Very large corporate organizations may feel a little bit more autocratic, where corporate decides and it just gets trickled down. When you get large enough at scale, one little decision can actually have very big impacts. And that's where we often see in the P&T committees, where one little decision can make huge cost issues or savings or access to care. And so having that more corporate autocratic feel may be really necessary just to be able to control costs and make sure the access is equal across the group. And I think probably the last one I probably would say is maybe more like a distributed or a collective. That probably be the last model I might wonder about, where everybody knows what, generally speaking, the mission, the values of the company, the organization, or the practice might be. But really, people get to do what they feel in their best zone of genius. So, for example, I'm just thinking even of like a collaborative group practice where there is a physical rehab, there's a massage group, there's the sports medicine, and all together, you're a huge conglomerate that can fulfill the entire rehabilitation services. And also, you aren't gonna micromanage each other because you're gonna leave everyone in their own personal zone of genius. But together, they band together like a whole bunch of surgeons, therapists, OPT, OT, and then go into the alternative modalities with pain control and other ways of managing pain and also therapy. So those are the ones that come to mind for me right now.
Yeah, Lily, this is really good to hear. And you and I work, and our team work with a lot of healthcare leaders, and they embody different aspects of what a great leader is. And everybody's a great leader in their own lives, but leaders in healthcare specifically have very large roles and a lot of responsibilities on their hands. And I'm curious, from the clients you've worked with or we've worked with that we can share with the audience here, what have we seen that a healthcare leader has embodied in terms of all the models that you just discussed, from servant leadership to collective to innovator? Which ones are doing well in the aspect of leading great teams with great scores, great feedback, where they're well respected, but also in their own lives that they're not suffering? They're finding ways to be well in their own lives. What would you say would that you see in terms of type of models that you're seeing that work best for personal well-being?
I would say that probably it all starts with everyone feeling comfortable in their own role and skin, and also being appreciated for that and feeling seen and heard in their smaller team and then their bigger team, and also getting to know what each other does. Because I think part of the bigger problem too is even a very large, even just department, you often don't know what other people are doing. And so trying to create community, so community is being so important, trying to cultivate that, having really transparent, open ways of communication really starts with you and just what you and I both know for ACLS, for even for trauma teams and cardiac arrest teams, what's really important is that we all come to it no matter what our role, whether we are just a CPR person or just the airway person or the theoretical team leader, is about flattening the hierarchy and making sure that we all give the information to the middle. The middle of this obviously is the patient. And so that we all know what's happening because somebody in that room is going to have a great idea. One of us is always going to be off at any given moment. When the 3 a.m. code, I'm really grateful for somebody else being a little more awake and knowing or suggesting that we should do something different. So again, the decentralization of the decision making where we're all working on the same mental model, which means that we all, even though we're very different, we could be a tech, we could be a nurse, we could be a physician, we're all coalescing around the same goal. And so I think if you took that same model for how trauma teams and cardiac arrest teams work in a very structured, programmatic way, those philosophies of it doesn't really matter what your pay scale or your hierarchy is. At the end of the day, when we make decisions together, we're all in all together. And I think from an action perspective, what we saw from the pandemic was that leadership rounding really helped that. A lot of times in the front lines during the COVID pandemic, we all felt really alone in our own little silos, in our own little pockets, whether outpatient or inpatient, that nobody cared about us. But when leaders began, I mean, the frontline administration, who normally we never see, begin to come out and just walk through, listen to us, hear us, praise us, figure out that, oh, I know where the resources are. It's in another part of this building. And go get those chaplains to come to the ICU and give some help. And so changing culture came from, again, flattening the hierarchy and like sharing the information so that people could have good ideas. And so listening rounds and leadership rounds really having some kind of routine checkpoint to do that, whether it be every other month or every quarter, some kind of routine structure where like, there is no agenda. Our agenda is just to listen as a leader. And then that way people also knew like this is your opportunity to give new ideas or just say things or acknowledge things. It's a great place just so that it's structured.
Yeah. So what I'm hearing too is that a lot of healthcare leaders, number one, embody a lot of these different models of leadership. But when we are all in service to the one thing that we all came into healthcare for, to help patients, it sounds like that has been a big key identifier that we've seen in our healthcare leader clients that have been the light at the end of the tunnel, what keeps them well in their roles as leaders, but as well as human beings in their own lives, because it can be very complicated when you are in the weaves of advancing, I guess, the business of healthcare that you may be
Mhm.
running and forgetting or being in the mix of the challenges that we are experiencing in healthcare. It can be very hard on your own life and absorbing a lot of that stress and the culture toxicity that can happen as a result of that as well. And so I'm curious to see, why do you think that servant leadership then maybe gets a bad rap?
Yeah, there's a question even within our own internal surveys about how much of this is service versus great or the use of your time. And I think the much longer ago, I guess I'm dating myself in terms of some of the more educational constructs for our training programs, was learning by doing is a reasonable way to learn things. Apprenticeship and other simple skill tasks, like it's the reps. People forget that I mean, from a pure cognitive science perspective, the more times you do something, the more time you spend in the game, the better you'll be. And I think the hard thing is we all wish we were expert immediately, and we don't really stop and savor the learning journey along the way. It's not that dissimilar in terms when we think about like patient care. Like, so sure, some of it may be not the most interesting, and yet you're getting your reps in, and each person's illness journey is slightly different every single time. There is learning to be had. And yet, even in I guess we organize our structure for how we do things. Oftentimes people get a bad rap because it's like, oh, there's no value in this care. This is just service. I just have to do this because this moves the needle forward. Well, I mean, yes, maybe so. Maybe it doesn't excite you. And how else could there be another way of looking at it? Because, I mean, the reality is I know people often feel like they are just a widget. They just feel like you're dispensable, like you don't actually matter, that you can just hire another nurse, you can just hire another doctor, no big deal. And yet you were meant to be there and be able to be with that particular patient or client at that time, and so be it. There's other people who would die to be in your shoes, to have gotten through as much training as you have, to be able to work for a stable organization, hopefully, that has patients coming in and patients choose your place. It's so busy. It is so busy. There's people waiting to come in. Yes, people need you. And so I know it can be really overwhelming. And I guess the question is how to just get through this next shift. How can you see it differently? To just be like, I'm just going to be here and do the best I can. I can't fix everything right in this exact moment. Other times when I'm sitting on a committee or other times when I'm doing those listening rounds with leadership, that something does have to change. People are dying in the waiting rooms. It is not appropriate that we're not providing better excellence in care. And how can we brainstorm solutions for how that might happen? Understanding that every single company has constraints. Every single locality has constraints. But how are we, for us, our community here, how are we going to make things different? And I think when we're in that service mode, I think we can have the opportunity that maybe we can just get through that time and be proud of what we've done. And we often forget that. And
Yeah.
I'm not sure why it gets the bad rap.
Yeah. Well, I think you called it out, maybe why it does. And those that are on the front lines, they're being part of the challenges of healthcare every day. And we all know that the healthcare system needs work and they absorb the stressors of work so much that when they see themselves as for service or when there's patients coming in and abusing staff, whether verbally, physically, mentally, to increase demands to see more patients, higher workloads, EMR charting, you need to put more things into your chart for billing. These things, they're like, it doesn't feel like a service anymore. It just feels like you're being told what to do. And I think you're right. When you embody that service mindset and remembering that the service is you providing care to the patient, you've worked so hard. You've earned a title that not many people have had the ability to earn, that would love to earn, to provide the care that you provide. I think helps bring that definition back to light and feel good. It feels good to know that. And if I think back to times when I practice medicine, when I feel that I'm truly in service, and I really feel it when I have a patient who is really caring, kind, and thankful for the care you're providing them. They often tell me, "Don't rush, don't worry, like, take your time," or, "I have a question, I don't wanna bother you," and I'm like, "Well, you're not bothering me, number 1. I'm here for you, I'm here to help you in any way I wanna make you comfortable. You're sick, you don't wanna be here." And just hearing that from their end, I think also really changes the direction of their care. It also, I think, really actually helps in healing them in ways that positivity. So I'm starting to love the word service more after this conversation.
Yeah, and I think you bring up a lot of great points about, like, there's so much brokenness in the world out there. Because you're providing servant leadership doesn't mean this forgives and absolves other people's responsibility to be a better human. I mean, I think the violent crimes against healthcare workers and the violence that has upticked everywhere across the country, especially in our healthcare settings, is abominable, and I think leaders are doing the best they can when trying to figure out a solution. I mean, if we had a solution just for our own private organizations, then I think we'd all have much more safer schools or churches and synagogues, but we don't. I mean, I think the reality is, at least in the United States, it's a scary time because you just don't know. And at the same time, everyone's trying their best, at least for those trying to make it so that places like the hospital, the clinic, wouldn't be the places where you would, of course, think about also having metal detectors and screening checkpoints, and which we all know also do coexist in this current modern day society. So I don't think it absolves it, but I do think that when we think about, well, why are we in healthcare? It can help do a reframe, especially in the hardest times, for how do you want to show up? What do you want to be known for? I think a lot of times people, well, what's your legacy as a healthcare professional? You actually do lead even from just being like one random provider for that day. You don't have to have any title to be an exemplar. I just think of some of the people I've worked with, like the exemplars. of who the best version of the cleaning staff, the secretaries. Like, I have prototypes burned in my brain of what the best version because of how they showed up for work every day. So it doesn't have to be a title.
Yeah, I like that because even myself, I don't have a leadership title and I still practice clinically, but I do feel like a leader. And I strongly believe that the rest of the team are leaders as well. When a patient sees them, they see them as a leader. They see them as they're leading their care. They're part of that. Nurses make their own decisions all the time in how to care for a patient. And I trust my nurses. Same thing with my team. Even the front desk, with the way that they answer questions for the patients, they're all leading in that manner. They're all experts in what they do. So I think we have to always remember that with leadership. It's not really a title, it's what you embody and it's what you do. And service is a good way to remember that you can be a leader by just giving your all to a patient. So for our final question today is we talked about all these models of leaders, servant leadership especially. How do you see the Institute for Healthcare Improvement, otherwise the IHI, the high impact leadership framework in action?
Yeah, so what they are stating is that they're recommending that new mental models, different high impact behaviors will help us get to a better healthcare in general. And so their argument is that our main goal should be better health for everybody, better care delivery for everyone, also in lower cost. Because I don't think anybody enjoys paying a lot of money for any of the care they get, whether you're on the front end or the back end of that. And so the question is, how do you get there? And so I think their framework suggests that focusing on the culture of your organization, the community, and the different types of engagements, the diversity of different departments, different groups being more engaged. And so I think because a lot of times we're often in our own silos, in our own pockets, outpatient versus inpatient, surgery versus medicine. And in general, we hang in different tribes and actually reduplicate similar structures within our own areas of expertise or areas of people. And really, we're all more alike than we are different. And so that idea of culturally at this organization, we don't behave this way. Whether you're an emergency physician talking to a GI specialist or talking to a subspecialty neurosurgeon, like it just isn't tolerated across this entire organization. So really being able to stand behind that. And I think that's where the power and the strength is actually back in the humans. I mean, I love AI. I love technology. I love innovation. I love new things. I am an early adopter, not a late adopter. Obviously, this company is we want to try to change things to bring coaching to democratize it for more healthcare professionals and to have everyone begin thinking of themselves as a leader. And yet, foundational to that is the human connection. That is the culture and the community of all of us.
Sharing community. I love it. And we are strong believers of culture and community and growth mindset. And so if you're interested, we have our Med Thrive community, which has been out since about a month now, and it's been thriving. And so we'd love to have you there if you enjoyed this servant leadership talk. You believe in growth mindset. You believe in the community that will be your backbone for growth and success. We'd love to have you there and hear your goals and be a part of making them possible. So thank you, Lily, for this talk, and we'll see you guys in the next episode.
Awesome. Thanks, everybody. Thanks so much for listening. If you found value in today's episode, please subscribe and share with a colleague who would benefit. Together, we can transform healthcare one person at a time. Find us anywhere you find your podcasts. Ready to take your healthcare leadership journey to the next level? Book a discovery call free at transforminghealthcarecoaching.com to explore our personalized coaching packages designed specifically for healthcare professionals like you.